Hello and a warm welcome. Thanks for joining my talk on insights from community health workers on concepts, articulation and addressing of mental health in Bangladesh. My name is Kyra Lilier. I'm from the Institute of Global Health in Heidelberg, Germany, and the study is in cooperation with the University of Liberal Arts in Bangladesh and the Sajida Foundation in Bangladesh. So let me give you some background on Bangladesh. Bangladesh is highly vulnerable to climate change with all its consequences. And from this setting and similar settings, we know that this does have severe impacts on mental health, reaching from trauma to depression, suicide, and so on. However, mental health and well-being is insufficiently targeted in practice, research, and policies in Bangladesh, though we do know that the need to do so is enormous. This means that in reality, there's almost no mental health support or healthcare available, especially in the rural areas. So this is where Sajida Foundation comes into place, and they're developing a mental health project to support these underserved, vulnerable communities. They're doing so by training community health workers with a basic mental health training. And this whole project is within a bigger research project where we use a human-centered formative design to co-create this intervention to support the communities and the community health workers in doing their job. So this data that I'm talking about now is the first data collection within this bigger project, and it's mainly derived from qualitative in-depth interviews with the community health workers themselves that have received the training. And they work in two different areas that you can see here on the map. And these areas are quite close to the coast, which means they're vulnerable to cyclones, floods, and river erosion, among others. Our thematic analysis has revealed three main topics, which is the understanding of mental health within the community, the articulation of it, and how the community workers themselves address mental health in the communities. And I'm going to go into this in a bit more detail now. So the community health workers have shared that there's widespread stigma in the communities, that mental health is not considered part of human health, that there's a lack of a concept to address mental conditions, that there's little awareness, and that they themselves consider mental health to be very important for human health now that they've received the training and learned about it. When it comes to expression and articulation of mental health, they shared that the community members usually share their emotions through facial expressions and behavior rather than using words. And that some community members like to not share their emotions and keep them for themselves. And they reported that this is that more men tend to do so than women. When it comes to addressing of mental health, the community health workers shared that they try to build trust among the communities by building rapport, for example, through small talk or simply spending time with the beneficiaries, and that they use language that replicates the terms used in the community that is appropriate, and they're trying to address mental health without maybe particularly naming mental health or without a concept in place to refer to. And then I want to just quickly share some suggestions or reflections about the project, the data, and the bigger project that it's collected within. So we use a mental health advocacy approach when designing this intervention to support the communities and the community health workers. And this means we're building on current provision of care, physical care in this setting, adding mental health care. We incorporate local understandings, and we do participatory intervention development. And through this, we hope to build a cultural sensitive intervention. We hope for higher levels of compliance, stigma reduction, and that in the end, we have a needs-based, decolonized support of mental health. And I want to raise the question how this could could be different or might be different from a mental health literacy approach, where we might introduce or psychoeducate a community to an already existing mental health concept. So we see this as a kind of bottom-up to top-down approach. Yeah, thank you very much for listening. Feel free to reach out. I'm happy to reflect and discuss this topic in depth. And I hope to see this discussion become more vibrant as we go. Thank you.